Hello, my name is Dr. Arnold Slyper, and I would like to tell you about my paper that is entitled A Paradigm Shift for the Prevention and Treatment of Individual and Global Obesity. Most obese people overeat, but why do they do this? There are two types of control centers in the brain that regulate how much we eat. There are homeostatic centers in the hypothalamus that tell us whether or not we are hungry or full up, and also hedonic centers higher up in the brain that initiate our hedonic responses, such as eating that extra cookie even though we are not at all hungry. But which type of center is primary? Which is the boss? Many experts think it's the hedonic centers, and it's the cakes and cookies that make us overweight. But I'm convinced that's not true. In a research study I published, I administered questionnaires to obese children to assess their hunger ratings, and my research found that many obese kids are hungrier than normal. In a new study I've been doing in Israel, I found that 45% of 100 obese kids have the highest rating on a 7-point scale and admit to being hungry for most of the time, versus only 3 out of 71 normal weight kids. This is a tremendous difference. My conclusions from this? Many people are obese not because they are reprehensible gluttons, but because their metabolism is abnormal. This current paper is the follow-up to this work. It describes the hormones that influence our hunger and how bariatric surgery and new hunger-suppressing weight loss drugs can influence our homeostatic centers through these hormones and override the hedonic centers. I raise the possibility that hedonic responses may be enhanced when there is an underlying homeostatic abnormality. It explains how fiber-rich foods such as whole grains, vegetables and fruits are able to reduce hunger and improve satiety. It points out that sweetened drinks provide very little satiety but lots of extra calories. I also explain how the American people have become so obese and why obesity is now spreading to the rest of the globe because of inadequate satiety from eating highly refined carbohydrate and sugars. Obesity is about eating too many calories, but to treat and prevent it, abnormal hunger has to be controlled. There are only two effective nutritional ways for doing this. 1, eating plenty of fiber-rich foods, and 2, eliminating sweetened drinks. I also provide recommendations for reducing global obesity. 1, place a substantial tax on sweetened drinks, and 2, use this money to subsidize fiber-rich staples. There is excellent scientific evidence that this type of tax does work in reducing consumption of sweetened drinks. Obesity can be successfully treated and prevented by controlling abnormal hunger. This is a paradigm shift for controlling obesity, and it's important because the treatment of hedonic gluttony and abnormal hunger are very different.